It's also Valentine's and Chocolate Day, as we call it here in Ghana. So I would love you all to spread the love, the agape love, I quickly add, in all endeavors today. My name is Margaret Yamo, and I'm coordinating the program this morning alongside
Jacob Akwa Ando from Ghana Health Service.
Okay, so I'm also from the Ghana AIDS Commission. Indeed, we are grateful for your presence this morning. This commemoration, which is a year-long program of activities, is under the theme 20 Years of HIV Antiretroviral Treatment in Ghana, Celebrating the Progress, Ending the Epidemic. I think it's a powerful theme for a remarkable milestone. And if you agree with me, let's give ourselves a round of applause. Great. So, ladies and gentlemen, we'll start the program with an opening prayer, and I would like to call Reverend Ken Ayedanso to do that. Shall we welcome him with a round of applause, please?
Good morning. Shall we bow down our heads and pray? Our Father, we want to thank you this morning. We thank you for this gathering. Even as we have met here, O Lord, even to celebrate ALTR 20. We invite your presence to be with us. We thank you and we bless you that this is going to be a successful meeting. In the name of the Father and of the Son and the Holy Spirit. Amen.
Amen, and thank you, Reverend Danso. Like I said before, it's a year-long program, and we'll be having a series of activities that will include a health walk. It would include the production of a documentary, visits to historic ART sites, and many other more. With us here today, I would like to introduce the dignitaries, and my colleague will come in and introduce some more. So if you don't hear your name immediately, don't be alarmed. On my far right is Madam Elsie Aye. She is the president of NAPLAS Ghana. Shall we give her a round of applause? Next to her is the UN AIDS Country Director, Dr. Cecilia Perez. We also have in our presence Dr. Franklin Esiedu Bequin, Director, Public Health Division, Ghana Health Service. And to the far left, we have Dr. Stephen Eyisi Ado, Program Manager, National AIDS Control Program. As with all programs, we have a special person who will chair it and steer affairs. And it's my honor's duty to introduce this special guest. She is known to us all because she's been in the HIV arena for a while, for a long time, I might add. She is a friendly, motherly figure, a product of Ebri Girls Secondary School and Wesley Girls High School. So you see, she's also one of the students of the first graduating class of the University of Ghana Medical School. I like the applause. She has served as a Deputy Program Manager of the National HIV and AIDS STI Control Program for 7 years. She was also Acting Director General of Ghana AIDS Commission from April 2017 to July 2018. Currently, she is the Presidential Advisor on HIV and AIDS. Ladies and gentlemen, join me in welcoming Ambassador Dr. Mokoa Ble Edujemfi as chairperson for today's launch. Madam Chairperson, we will accept your remarks now, please. Thank you.
Valentine's Day. Ladies and gentlemen, esteemed guests, honored colleagues, good morning and welcome to this momentous occasion as we gather to celebrate the launch of 20 years of HIV antiretroviral therapy in Ghana. It is with great pleasure and pride that I stand before you today as we embark on a journey to commemorate the incredible impact and progress of antiretroviral therapy in the fight against HIV/AIDS. The introduction of antiretroviral therapy 20 years ago represented a significant milestone in the history of HIV treatment. It marked the beginning of a new era offering hope and life-saving treatment to millions of individuals affected by this devastating disease. Today, we come together to recognize the monumental efforts and achievements that have been made in advancing the accessibility and effectiveness of antiretroviral therapy. As we embark on this years-long celebration, it is important to reflect on the profound impact that antiretroviral therapy has had on the lives of people living with HIV. It has provided hope, dignity, and a renewed sense of purpose to individuals and communities around the world. We have a lot to do today, so I'll let the MC take over, and I'll be back to give my closing remarks later. Again, I wish you all happy Valentine's Day. Thank you very much.
Let's do it better for Madam Chair. Thank you once again. Thank you very much for accepting to chair this morning's program. Before we go to the next item on the agenda, I would like to introduce other dignitaries who are here in our midst. We have Mrs. Belinda Amankwa from UNDP here. Let's see you, please. Thank you for coming. We have Dr. Emil Asamoah Odey. He was a former program manager at NACP and also a retired WHO staff. Thank you for coming. We have from the CDC, Dr. Tony Au, the country director, also here in our midst. We have Dr. Ni Akwe-Addo, former program manager, NACP, and now with Equip Health Ghana. We have Dr. Paul Jani, UNICEF, also here in our midst. Thank you. We have Prof. Kusi Tope, Dean, School of Public Health, University of Ghana, also here with us. We have Dr. Innocent Ibe Bunam. I hope I got the name right. Yes. Dr. Innocent. He is the Chemonics PSU Country Director. Thank you for coming, sir. From WAPCAS, we have Mr. Kofi Diaba, Deputy Director, also here in our midst. Let's see you. Then we have Lady Nanaya Nsako, Miss Malaika. Somebody may be wondering why she's here. She's also ambassador for HIV and AIDS. So thank you for coming. Then from the Ghana Service, we have other program managers who are here to support their colleague. We have Dr. Adusi Poku, Program Manager, NTP, that is the TB Control Program here in our midst. We have Dr. Kunamako, the PM, National Bully Osa, Yours Eradication, also here. We have Dr. Kwame Amponsa Achiano, Program Manager, Expanded Program on Immunization. So we'll acknowledge the dignitaries as and when I get them. But now I'll call on the Director of Public Health, Dr. Franklin Esiedu-Bekwe. Okay. So I call on the Director, Public Health, Dr. Franklin Esiedu-Bekwe, to formally welcome us. As part of the welcome, he will also be outlining some of the activities that we'll be doing to commemorate the ART at 20. Please, with a round of applause, help me welcome him.
Thank you very much, Mr. MC. So, Madam Chairperson, who is the Presidential Advisor on HIV/AIDS, Dr. Mukua Bili Edujemfi, the Director General of the Ghana Health Service, who is yet to join us, the Director General of the Ghana AIDS Commission, the Country Director, UNAIDS, CDC Country Director, the rep of the Joint UN Team on AIDS, Dean of the School of Public Health, Ms. Malaika 2023, who is the Ambassador for HIV/AIDS, CSOs, a rep of NAPLAS, Deputy Directors, Program Managers, and staff of Ghana Health Service, media, ladies and gentlemen, and esteemed members of the press. It's a tall list. I hope you are able to capture most people here. Good morning and a warm welcome to this momentous occasion as we celebrate the 20th anniversary of the groundbreaking antiretroviral therapy in Ghana. It is truly an honor to have you all here today as we reflect on 2 decades of achievements in HIV treatment and the positive impact it has made on our countless lives. 20 years ago, the landscapes of HIV/AIDS care underwent a remarkable transformation with the introduction of antiretroviral therapy in Ghana. This therapy revolutionized the field, providing hope, extending lives, and improving the quality of life for those living with the disease. Today, we gather to acknowledge the tireless effort of researchers, scientists, healthcare professionals, and advocates who have worked diligently to bring us to this significant milestone. Back in 1986, Ghana was fraught with fear, uncertainty, and the loss as the HIV/AIDS pandemic continued to ravage communities across the globe. People living with HIV face immense challenges, yet they remain resilient and hopeful for a breakthrough that would alter the course of their lives. It was within this context that antiretroviral therapy emerged as a beacon of hope, offering the promise of a brighter future. Over the past 2 decades, antiretroviral therapy has continued to evolve and improve, leading to remarkable outcomes. We have witnessed the transformation of HIV/AIDS from a virtual death sentence to a manageable chronic condition in many parts of the world. The impacts have become profound and far-reaching, not only in terms of individual health, but also in reducing transmission rates, breaking that stigma, and changing societal perceptions. Today, as we celebrate this milestone, it is crucial to acknowledge the collaborative efforts that has driven progress. The triumphs we have achieved are the result of a collective collaboration, mobilizing governments, organizations, healthcare providers, and communities to prioritize a comprehensive approach to HIV/AIDS treatment and prevention. We owe a debt of gratitude to the dedicated researchers who have tirelessly worked to develop and refine antiretroviral therapy. Their perseverance and commitment to scientific inquiry have advanced our understanding of the virus and its treatments, paving the way for the development of more efficient and accessible medications. It is through these unwavering efforts that we can celebrate this remarkable progress today. I would also like to take a moment to acknowledge the resilience and determination of persons living with HIV and the countless activists who have fought for equitable access to treatment and care. Their advocacy has been instrumental in shaping policies, breaking down barriers, and empowering communities to demand their rights and shape their own destinies. As we commemorate this 20th anniversary, let us not lose sight of the challenges that lie ahead. While tremendous progress has been made, we cannot rest until every person, regardless of their socioeconomic status or location, has access to life-saving antiretroviral therapy. We will continue to tackle stigma, discrimination, and inequality, ensuring that the benefits of innovation reach those who need them the most. Today, we gather here not only to celebrate the significant achievements of the past, but also to renew our commitments to eliminate HIV/AIDS once and for all. Let us be inspired by the progress we have made, and let it serve as a reminder that together we are capable of overcoming seemingly unsurmountable challenges. This remarkable achievement will be commemorated throughout the year with a number of activities, and these include media engagement on ART themed ART Saves Lives, tour of some historic HIV sites, special time with NAPLAS, inter-school and college quiz and debates, school-based seminars for young adolescents on HIV, ART with Ms. Alaika and experts, national charity ART soccer competition between past soccer players of Asante Kotoko and Kumasi and Accra House of Folk. The health work DAP, Adhere to Survive, and HIV rally. So these are a number of the activities that have been listed to commemorate 20 years of ART in Ghana. We also have legacy projects, the modern e-library projects, and countdown to epidemic billboards, and climax on events on World AIDS Day with a deba. I would like to conclude by expressing my heartfelt gratitude to all the individuals who have dedicated their lives to this cause. Your tireless efforts, passion, and perseverance have transformed the lives of millions. The journey ahead may be arduous, but together we can create a future free from the burden of HIV. Thank you once again for joining us on this momentous occasion, and I call on all of us to join in this celebration. I look forward to the fruitful discussions ahead, and we continue to progress together. Thank you very much.
Let's do it better for him. Thank you very much. That was a welcome address by the Director of Public Health, who also outlined some of the activities that we've earmarked for the ARTR 20 celebration. We know that you are going to be with us to support us to make it a success. The audience for today's meeting is actually the media, so let's acknowledge their presence. All the media houses that are here, let's see you. Our press, thank you for coming in your numbers. Then we also have the staff of Ghana Service and NACP, National AIDS Control Program here. Please, let's see you. Let's see you. Thank you. As part of this program, I'll be mentioning some of the committee members who made this and other events that have been planned a success. So I'll mention their names for you to know them. Then we have from the UGMS, representing the Dean, Dr. Adjoa Afrani, also here with us. Let's see you, Doc. Thank you for coming. Then we have DCOP Jones Blantari, also here with us, from the Ghana Police. Thank you for coming, sir. So we'll move on. We've put together a documentary that is itemizing some of the activities that we are going to do, as well as some of the successes and the challenges that we have faced as a service and as a program, looking at ART at 20. So technical team, if you are ready, let's move with the document.
Might of a country is decimated. Enemies take over and the nation's productive machinery grinds to a halt. So was it, analogically, when HIV and AIDS first struck Ghana in 1986. The human anatomy could not withstand the onslaught of HIV. 17 years later, in 2003, Ghana weathered the storm by introducing HIV antiretroviral treatment, ART. This saved the nation. 20 years down the lane, it is worth celebrating our successes. We still need to work together to ensure that all persons living with HIV are enrolled and retained on ART, antiretroviral treatment. It is 20 years of art in Ghana, and we'll work on this. Join us as we celebrate our story.
The first case of HIV was detected in 1986, and the National AIDS and STI Control Program was established a year after. It, however, took 17 years, almost 2 decades, for us to introduce antiretroviral therapy, and we are very, very proud of that feat. That has enabled a lot of Ghanaians to survive and to secure the health and well-being of people who at that time did not have any hope. Initially, it appeared to be a death sentence. There were no obvious medications to manage cases. So the idea is that what's going to be the fate of even health workers, what's going to be the fate of mothers and their children if they should get pregnant. So 20 years down the line, you can see that the prevalence of the disease in adult population has been less than 2%, meaning that it's quite low compared to other countries.
In Ghana, as at the end of 2022, about 355,000 people were estimated to live with HIV. And this number, cuts across all ages, gender or sex, and all social groups in the country. So from the age 15 to 49, that is where you have the chunk of the people living with HIV. But if you break it down, you see that HIV mostly affects people between ages 25 and 40.
Currently, we can also speak of the fact that about 25% of the people who are on ARTs are over 50. We are reporting a significant number of HIV positive mothers who are also having babies who are negative, which is a plus for the introduction of ARTs and for the fact that it saved so many lives in Ghana. UNAIDS and the United Nations Joint Team on AIDS have been providing support to the country through technical assistance and advisory for the development of national policies, national strategies, and field implementation of the best evidence-based practices to be able to achieve the commitments the country have adopted through the HIV political declarations, and also to be able to have an adequate and efficient implementation of the National HIV Strategic Plan. Prior to the introduction of antiretroviral therapy in 2003, we were using cotrimazole, or as many people know, Septrin, as prophylaxis against opportunistic infections. But with the introduction of antiretroviral therapy, the virus is suppressed and many people are better off because there is immune reconstitution.
HIV treatment has evolved, and with scientific advancement and innovations, we now have antiretroviral medicines that not only treat and manage the conditions associated with HIV infection, but also help to prevent HIV transmission from persons living with HIV to their partners or unborn babies.
Many years ago, we just started with 2 sites. Now we have 735 sites across the country, and that provided unfettered access to all those who need it. Although there are a few times we've had a few challenges, but we've been able to address all of them.
We use various criteria to initiate people. CD4 criteria initially of 200, and then later on it moved to 350 to 500, till today, where we are initiating people on antiretroviral therapy without any criteria. So we have actually started implementing the test and treat and same-day initiation of people on antiretroviral therapy.
initially, the guidelines that the WHO provided had 3 options: option A, B, and B+. Now, options A and B were to ensure that mothers receive antiretroviral treatment during the pregnancy period and the time after delivery. And the option B+ is actually the option that makes antiretroviral treatment, available for the mother throughout the pregnancy period and after the pregnancy period. So it gives mothers and their babies, the best option of ensuring that mothers actually adhere to treatment, achieve viral suppression, and maintain their viral suppressed status to reduce the chances of their babies, whether born or unborn, to contract HIV.
As we know, the country has committed with the 95-95-95 goals established by the 2021 AIDS Political Declaration, which means 95% of people living with HIV should be diagnosed. Of these, 95 should be in treatment, and of these, 95% should be in suppressed viral load levels.
Every 5 years, we develop HIV and AIDS strategic plan. And that strategic plan is a medium-term plan, as it is stipulated in government policy guidelines. And so we are currently implementing the 5th strategic plan. So from 2021 up to date, we have been developing and implementing a national HIV and AIDS strategic plan.
One of the things that we expect as a country is that people need to test. So as a program, we have now introduced the self-testing. The idea is that if you know your status, then you can easily be put on medication, and then HIV does not become a death sentence. So Ghanaians should take this opportunity to use the ART as much as possible. Make sure that we are sticking to it, and then HIV will no more be a death sentence.
The major challenge we have as a country is stigma and discrimination against persons living with HIV or those affected by HIV. And because of stigma, people living with HIV often go underground and wouldn't want to access HIV services. And so we have to address the issue of stigma. And we have used legal means by promulgating a law that proscribes stigmatizing or discriminating against any person living with HIV or affected by HIV.
The persons living with HIV and other groups affected by the epidemic, we need to let them lead the response. We need to collaborate with them to guide the future of Ghana and to be able to create multi-sector national HIV policies that take Ghana to the end of AIDS by 2030.
We acknowledge the challenges faced, including the opaque supply chain and inadequate planning in administering drugs to persons living with HIV at ART centers. These challenges have posed significant barriers to accessing life-saving medication and maintaining treatment adherence. However, amidst these difficulties, we commend the resilience and dedication of persons living with HIV, healthcare providers, and advocacy groups in advocating for improved access to antiretroviral therapy and addressing systemic shortcomings.
Today, we celebrate the progress we have made despite all the challenges. There are an estimated over 100,000 people who do not know their status. But we want to encourage all Ghanaians to test and be linked to treatment, because nobody should die from AIDS today because there is antiretroviral therapy.
This service across the country has not just been for Ghana Health Service alone, but we are also doing partnership with private sector and other people who are supported with studies, World Bank among others, to ensure that we are collaborating not just with our partners, our private sector, to offer access to HIV medication across the country.
So we want to appreciate all our partners over the years for the support.
Government of Ghana, the Global Fund, USAID, the Ghana AIDS Commission, UNICEF, UNAIDS, the World Bank, and the WHO, among others, who have supported us in several ways to ensure that we create access to quality ARTs to all those who require them.
Phenomenal successes in antiretroviral treatment we have achieved, but challenges we still have. With an estimated 354,927 persons living with HIV and 230,317 AIDS orphans in the country, we should ensure that we work together to eliminate HIV as a public threat. We therefore invite Ghanaians to test to know their HIV status and be linked on time to antiretroviral treatment, ART if needed. We entreat those on treatment to adhere without default. We call on all to join the Ghana Health Service and all stakeholders to celebrate the heroes and heroines of our successes. We will confront the issue of post-donor HIV financing and mobilize resources to invest in research and technology. May God cause our deliberations and endeavors to blossom.
Thank you very much. So nobody should die from HIV because we have ART. That was the key message out there for all of us. We will move on with the rest of the agenda, and I would like to introduce Mr. Ernest Otson, Garnet President, one of the CSOs in HIV management in the country. Thank you for coming, sir. And we are privileged to also have Dr. Fred Nanapoku, Director Technical Services, representing the Director General of the Ghana AIDS Commission, also in our midst. Thank you for coming, sir. And I'll hand over the microphone to him to give us a message. As we indicated earlier on, this is not just a Ghana Health Service event, it's relevant agencies and partners. So we are happy as a service to partner with the Ghana AIDS Commission in making this commemoration a success. And we are privileged to have the rep of the Director General here in our midst. So I'll call on Dr. Nanapoku to give us a word. Please, let's welcome him.
Good morning, everyone. I'm honored to be here, and I bring greetings from the Director General of the Ghana AIDS Commission. I recognize the Presidential Advisor on HIV and AIDS, Ambassador Dr. Mukwa Ble Edujemfi, and all other representatives of government agencies, chief directors. I recognize the UNAIDS Country Director, Mr. Cecilia Perez. I recognize all agencies. Sorry, I don't have the entire list. All protocols observed, please. Once again, I bring greetings from the Director General of the Ghana AIDS Commission, and today is a very great day because in our lives, when we are 18 years, we say we are of age. And I believe that the ART program in Ghana is of age. Since we started in 2003, there have been ups and downs, but with the resilience of the health sector, with the resilience of health workers, programmers, civil society organizations, and every other partner, the UN agencies and donors, we have come this far. We have been able to put people on treatment, and as we see from the documentary, the statistics shows. Yet, we know there are a lot to be done. This includes ensuring that every single person gets to know his or her status and is put on medication. Innovations has made it such that ARTs does a lot. It's also even preventive, as we know, preventing infections through the utilization of the medication as PrEP, preventing HIV using the medication through the use of it as PEP, that is post-exposure prophylaxis, and preventing mother-to-child transmission of HIV. We all acknowledge the challenges that exist, and one of the key things we want to do moving forward is looking at how best we can produce the ARVs in country because of the numerous challenges we face in logistics management of ARVs and its shortages in the country. Another key area we are all aware is about early infant diagnosis. How do we get our infants diagnosed and placed and remain on treatment? This has been a lot of challenges, but I believe and know that with the resilience of everybody, the program, NACP, UNAIDS, civil society organizations, others coming on board, the mother-to-mother program, we were able to surmount our challenges. We ought to celebrate, and while celebrating this anniversary, we have to think ahead. What are our plans? What do we intend to do differently to ensure that we reach the 95, 95, 95, and everybody or nobody dies of HIV, and we eliminate AIDS as a public health threat by the year 2020. On this note, I want to thank everybody and encourage everybody. Let's keep on keeping on till we get to our destination. Thank you and have a very blessed day.
Thank you, Dr. Fred Nana Poku. Shall we give him a round of applause? I'm happy to hear that there are attempts or revived attempts to produce ART in country. I know it started some years ago. I don't know what happened to it, but I'm very happy to hear that. We're now going to take the solidarity statements from our partner organizations, and we are going to begin with JUTA. So I would like to call on Dr. Hector Susila Perez, UNAIDS Country Director, for his remarks. Let's welcome him with a round of applause, please.
Thank you so much. Dr. Moko Ablay Adugiamfi, Presidential Advisor on HIV/AIDS. Dr. Fred Nana Poku, representative of the Director General of the Ghana AIDS Commission. Dr. Patrick Kuma Awagi, Director General of the Ghana Health Services. Dr. Stephen Ajiziado, Program Manager, National AIDS Control Program. My friend Dr. Tony Au, Director of CDC Ghana. Madam Elsie Aye, NAPLOS, and dear friends, partners working in the HIV response, staff from government, civil society organizations, development partners, academics, and the different media houses. Please receive the warmest regards from the Joint United Nations Program on HIV/AIDS, UNAIDS, and from the Joint United Nations team on AIDS in Ghana. Good morning. As we gather today to commemorate 20 years of HIV antiretroviral treatment in Ghana, it is important to reflect on the remarkable achievements and ongoing challenges that have shaped our journey in the fight against AIDS. Over the past 2 decades, Ghana has made significant strides in expanding access to life-saving antiretroviral treatment for individuals living with HIV. Ghana is offering today the best available recommended antiretroviral regimens to persons living with HIV in a large-scale network of public and private services along the country through efforts led by the government in coordination with civil society organizations, networks of people living with HIV, and with the support of different development partners such as the Global Fund, PEPFAR, including CDC and USAID, and the United Nations. These partners have contributed to this successful history during these years. Thanks to these efforts, the Ghanaians can get the treatment free of cost for them through differentiated delivery strategies. This achievement cannot be overstated. It has resulted in prolonged and improved quality of life for countless Ghanaians, to the decline of new infections, and in the reduction of AIDS-related deaths. Furthermore, our efforts have led to increased awareness and education on the benefits of the antiretroviral treatment as a preventive tool, the reduction of stigma and discrimination in health services providing antiretroviral treatment and care, and the empowerment of communities to advocate for their right to health and to define models of care based on their real needs. These achievements are a testament to the dedication and hard work of healthcare professionals, advocates, policymakers, and persons living with HIV who have courageously shared their stories and fought for universal access to treatment and care in this country. However, amidst these successes, we also recognize the continued challenges that confront us. So, this ART at 20 celebration must be looked like the opportunity for the country to have a serious reflection on these challenges and the bottlenecks affecting our progress to achieve the 95, 95, 95 goals, and all the commitments adopted by Ghana through the 2021 Political Declaration on HIV/AIDS, ending inequalities and getting on track to end AIDS by 2030. Despite progress, access to HIV testing and antiretroviral treatment remains uneven across different regions of Ghana, between men and women, between adults and children, and between urban and rural areas. Just to mention a few examples of the existing inequalities to access HIV testing and antiretroviral treatment. Nowadays, 28 of each 100 Ghanaians living with HIV are not aware of their status. 37 of each 100 Ghanaians living with HIV are not accessing to antiretroviral treatment. And the challenges on accessing viral load suppression tests are an obstacle to understand the progress to ensure all persons living with HIV have undetectable viral loads. Also, stigma and discrimination continue to hinder efforts to reach those in need of treatment. In accordance with the 2022 Ghana Demographic and Health Survey, 78% of women and 72% of men, respectively, aged 15 to 49, have discriminatory attitudes towards people living with HIV. Furthermore, the COVID pandemic and other global emergencies have created disruptions in healthcare systems and posing additional obstacles to HIV testing, treatment, and prevention efforts. It is imperative that we adapt and innovative in the face of these challenges, ensuring that essential services and support for HIV are not compromised. My dear friends, the moment for Ghana is now. We need collective and coordinated action to end AIDS by 2030. The country needs urgent and accelerated scale-up testing, treatment, prevention, and care throughout the increase of sustained domestic funding for the next 6 years. So we need to prioritize a national HIV sustainability roadmap as our critical guidance. Logistic and administrative bottlenecks affecting the planning and supply chain of HIV-related commodities, including tests, antiretroviral treatment, and condoms, must be solved on an urgent basis. By means of collective action, a shortage or stockouts cannot continue undermining our response to this epidemic. We need to take collective action to eliminate any kind of stigma, discrimination, and violence at community level, in healthcare premises, schools, work, and any other settings. The access to antiretroviral treatment and other HIV-related services cannot be conditioned to these factors. Finally, I want to make a call to prioritize the empowerment of communities in order they can help us to lead the response, as their role is critical in supporting behavioral change actions to prevent HIV, for the delivery of combination prevention services, for the provision of testing and linkage to treatment, for the promotion of adherence to treatment, and for advocacy and sensitization to eliminate all forms of stigma and discrimination. As we look to the future, let us acknowledge the challenges while also embracing the opportunities that lie ahead. We must remain committed to expanding access to testing and treatment, strengthening prevention efforts, and addressing the social determinants that fuel the spread of HIV. By working together, we can overcome these challenges and continue making strides towards an AIDS-free future for Ghana. Thank you so much.
Thank you very much, Dr. Hector Cecilia Perez. Shall we give him a round of applause? Thanks for highlighting some of the gaps and challenges in the response we need to improve on and the opportunities we can take advantage of. I'd like to recognize the presence of Dr. Anthony Ashino, Deputy Program Manager, NACP. Just give us a wave, please. Thank you. And then the Executive Secretary of CCM, Samuel Hackman. Thank you. So we are continuing with the solidarity statement, and we're going to take the next one from the PEPFAR representative, Mr. Tony, our Director of CDC. Let's welcome him with a round of applause.
Recognizing Dr. Ambassador Makoa Blay Adiuk Jiamfi, the President Advisor for HIV and AIDS and the chairperson for this event. Dr. Jeremy Atuahene, the Director General of the Ghana AIDS Commission, represented by Dr. Poku. Dr. Patrick Kuma Buaji, the Director General of the Ghana AIDS Service. Dr. Franklin Asiedo Beku, the Director of Division of the Public Health. Dr. Stephen Ayisado Ado, the Program Manager of NACP. Madame Elsie Aye, the Executive Director of NAPLAS. Dr. Hector Cecilia Perez, the UNAIDS Country Director, and other dignitaries present here. Also greetings to the members of the media, the members of the Government of Ghana workforce, the multilateral and bilateral missions, and civil society organizations. Ladies and gentlemen, all protocols observed, and good morning. It is a pleasure and an honor for me to represent the Interagency United States President's Emergency Plan for AIDS Relief, also known as PEPFAR, which includes USAID, the US Department of Defense, the US Department of State, and my home agency, the US CDC, on this ART at 20 media launch event entitled 20 Years of Antiretroviral Treatment in Ghana, Celebrating the Progress and Ending the Epidemic. The event today is an important part of our national HIV response. It tells the story of, by working together, governments and developing partners and civil societies, we have made life-saving medicines free and accessible to millions, and have taught millions about prevention strategies for HIV, and have empowered millions of people living in with HIV to live happy, healthy, and productive lives. Last year, we also celebrated our 20th anniversary of the US PEPFAR program. And globally, PEPFAR has saved over 21 million lives, prevented millions of HIV infections, and helped over a dozen countries control the HIV epidemic, including Ghana. The United States will continue to assist Ghana and other countries in West Africa region and in Africa to meet the UNAIDS 95-95-95 HIV treatment target by 2030. This means that the goal is to diagnose 95% of all HIV positive individuals in the country, to provide antiretroviral therapy for 95% of those who are diagnosed, and to achieve viral load suppression for 95% of those who are treated by 2030. In Ghana, PEPFAR worked to support under the partnership and the leadership of the Ghana Health Service and the regional health directorates to support prevention and care and treatment services in 3 regions, that is Western, Western North, and Ahafo. We also support to improve laboratory quality management systems as well as data systems to help strengthen the national and regional HIV response. Lastly, we contribute to the effort to reduce stigma and discrimination. But we don't work alone. And the government of Ghana and the Ghana's active civil society is our critical partners and are crucial to the continued success of combating HIV and AIDS in Ghana. I would like to echo the sentiments of my friend and colleague, the UNAIDS country director, and mention that communities are at the core of the national HIV response. Communities have the trust of the people and is the foundation of an effective AIDS response because they are an important pillar of support by advocating for access to treatment, respect, and dignity. Communities ensure effective individuals get the treatment that they need and how they need it and where they need it. Community-based organizations are fighting to keep affected people at the center of decision-making and program implementation. They are fighting to ensure that no one is left behind. No population affected by HIV, none, should be denied of the basic rights of health care. All people living with HIV deserve the delivery of HIV services and deserve to live free from stigma. People living with HIV also deserve to have their human rights respected and to be able to accept the support from their peers. They deserve to not be placed in legal risk because of their sexuality, nor to be exposed to harassment and abuse. The heroic healthcare workers who have helped save hundreds of thousands of Ghanaians living with HIV deserve to be able to continue to do their work without fear of arrest. Ghana's history of tolerance and respect for all is central to the extraordinary success of this country and has had in combating the HIV epidemic. If this disease is not to return to devastate millions, that tolerance and respect must endure. The US government is dedicated to support Ghana's leadership and vision in its HIV and AIDS program. Allow me to recognize the incredible work that Ghana Health Service and the Ghana AIDS Commission, who far are too often lack the recognition that they merit. The US will continue to work to support your work by leveraging our local capacity, improving coordination, finding efficiencies, and supporting country priorities. Together, we can make a difference. Together, we can also break the cycle of transmission. Preventing new HIV infection and supporting those with HIV/AIDS is not just about medication. It's about education and reducing stigma and discrimination against persons living with HIV. It's important for everybody to know the HIV status. Key to that is preventing new HIV infections. No single prevention method can be effective by itself to control the HIV epidemic. If you are negative, continue to make informed decisions to keep yourself negative. If you are positive, seek the life-saving and transmission-breaking treatment available to you in many of Ghana's community-based facilities. And in the past few years, we have learned about the treatments with ART can also prevent the spread of HIV, and this is called U equals U, or undetectable equals untransmittable. Once on treatment, and your treatment is monitored, the virus may become undetectable in your body, and therefore the virus becomes untransmittable to others. So this is an important concept that requires scale-up of treatment as well as prevention services. Thank you to all the Ghanaian community workers and faith-based volunteers who spend countless hours to work tirelessly to help the towns and villages in this national response. Lastly, as we look back to celebrate the progresses and achievements proudly as a collective, we should also look forward to work together and address the challenges ahead bravely, so that communities that are AIDS-free, everyone has equal access to healthcare, and the lessons that we learn from defeating HIV and AIDS will equip us to deal with equitable and successful with other health challenges as well. Thank you so much for your attention.
Thank you very much, Tony Al, for your remarks and for reminding us that communities are the core of the HIV response. I'd like to recognize the presence of the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji. Thank you. So we'll continue with the solidarity statements, and the next is the representative of the CSOs, Mr. Ernest Oting, President of Gannett. Let's welcome him, please.
Madam Chairperson, Ambassador Mokowa Blay, Director General Ghana Health Service, Dr. Kuma Abuaji. Madam Chair, with your permission, I would like to stand on all the existing protocols so that we don't waste much time. And I'm very happy to be presenting this statement on behalf of the Ghana HIV and AIDS Network. Ghana HIV and AIDS Network has been an integral part of the national response since its founding in 1996. In the year 2002, when Ghana AIDS Commission was established, Gannett was one of the civil society organizations that was accorded the privilege of serving on the Commission's governing board. This afforded the network the opportunity of deploying its members across the entire country to support the national response at the regional, district levels, and took part in all the campaigns that took place across the nook and cranny of the country. Running public campaigns on HIV and AIDS in Ghana in those early days was not really an easy task. For a disease that had no treatment available, the general notion was that once you contracted it, you were going to die. One of the things that heightened anxiety was a campaign message which stated that a whopping 200 people were getting infected with a virus each day. Consequently, there was a lot of fear and panic in the system, and this created a huge cloud of stigmatization and discrimination around the disease. To the credit of the government of the day and the public health experts in the country around that time, the adoption of a multi-sectoral approach in the national response through the Ghana AIDS Commission proved to be quite strategic. It was able to rally support from all segments of the Ghanaian society and created the needed awareness that was necessary for people to take precaution. It was therefore not a surprise when the national prevalence started dropping. By the latter part of 2003 and early part of 2004, when antiretroviral therapy was introduced in the country for the first time, the forlorn situation of persons living with HIV and AIDS suddenly glimmered. It was the salvation many PLWHA had been praying for. The rollout, however, was still tinged with some amount of skepticism, as some of the persons living with HIV had already cemented their faith in herbal concoctions. Some were therefore adamant to embrace the new treatment, and unfortunately, they lost their lives. It is heartening to note that for those who complied with a new treatment regimen, many survived and flourished. A typical example is the current president of the network of persons living with HIV, who will soon be talking to us, who has been on treatment since the last 20 years. There are several other PLHIV who have also significantly improved their health and social conditions through ART. For example, through ART, there are now persons living with HIV who are married and have children who are not HIV positive. This indeed is ample testimony that ART saves lives. And on the basis of this, Garnet is exhilarated to be associated with the celebration of ART at 20 in Ghana. The network pledges its commitment to support the work of the planning committee and participate fully in all activities that will be organized. We congratulate National AIDS Control Program, Ghana Health Service, Ministry of Health, Ghana AIDS Commission, and all development partners, particularly the Global Fund, for initiating and supporting all this important initiative. As we race towards ending AIDS by 2030, it's our fervent hope and prayer that this celebration will rekindle the national campaign, most particularly among the general population, so that together, hand in hand, we would all work towards eliminating the disease. And I would like to end by saying that this is a fight that we must all win. Thank you very much for your attention.
Thank you very much, Mr. Otson, for your remarks. I don't know about you, but I was so excited. I've heard it before, but hearing it again gave me goose pimples. The success story of 20 years plus of taking ARVs, and the fact that persons living with HIV can marry and have children without HIV. It's nice to hear. So let's give ourselves a round of applause for all our efforts and everything towards this program and other things. So we'll take the last statement from Madam Elsie Aye, the president of NAPLAS Ghana. Let's give her a round of applause. I'm sure she has a lot to say. Thank you.
Thank you very much. Madam Chair, permits me to stand on the existing protocols. The Ghana Network of Persons Living with HIV, NAPLAS Ghana, stands in solidarity with all persons living with HIV, the National AIDS Control Program of the Ghana Health Service, and all stakeholders in the fight against AIDS to celebrate 20 years of antiretroviral therapy in Ghana. As the president of Garnet already had mentioned, I am privileged to be celebrating my 20th year of antiretroviral treatments. This has been a source of strength to me personally, my family, and the family of persons living with HIV. They always say, I challenge them. This year also, I'll be 70 years old. And it is all due to being on antiretroviral treatments for the past 20 years. Many lives have been lost, many lessons learned. Some lives also, many lives have been saved. Some have been lost, but many lessons have been learned. And the greatest one is the efficacy of consistently taking antiretroviral medication. While commemorating the 20 years of antiretroviral treatments, we can't help but also remember or realize that the effects also of an HIV positive result caused also so many negative effects on persons living with HIV. First was accepting one's status, and it's still continuing. Even with people who were tested yesterday, who are yet to test, I got calls also as I sat here of people who somebody was diagnosed in 2018, and she refused to go on treatments. She said what she heard about the effects of antiretrovirals told her, what, I'm not going to add that to my situation now. So she refused. But thankfully, she responded to a call that we had put out to come on treatment. She just called me. She's taking her medication. She feels good about it. She was given for just 2 weeks and told to return because 6 years of refusing, I mean, we're not sure. But she called to say she's returning from the facility. She's fine, and she'll continue keeping on her medication. That is so heartening. I mean, it's something that makes me feel 10 feet tall, though I'm not part of the whole, I'm not the only one who is part of the whole thing. But one thing that is still an issue is our self-confidence, which goes way down when we test positive. We start wondering, who gave me the HIV? Where did I get it from? That is immaterial. What is important is we are positive. There is treatment. Go for it. It will work. There are people who, because of past experiences of family turning them out of their home, people talking, verbal harassment, physical harassment, are afraid even to go for treatment. But I want to seize this opportunity to appeal, especially to families of persons living with HIV, and others who don't even know that members of their family are positive. It is possible to deal with HIV. We don't want to progress to AIDS. So I am appealing, please accept all persons living with HIV. Support us to continue keeping on treatments. Your support is paramount. It is a source of strength. It is our backbone. We know National AIDS Control Program is there for us, and they do all that they can to support us. But within the family, we need that support. So I would want to call on family members to help us. Also, there are some Ghanaians who also believe that persons living with HIV, and even those who are key populations, do not have the right to life. This is wrong. This is wrong. And I think, and I know, that all Ghanaians, according to our constitution, have a right to life. Ministry of Health is there for the health care of all Ghanaians, irrespective of your sexuality or anything. So let us live and practice what our constitution allows us to do, so that persons living with HIV will go for their treatments without fear. They would work, struggle, strive to be virally suppressed so that they do not spread HIV to other people. So while with our partners trying to look at sustainability of HIV, sustainability of our intention, our strive towards having an AIDS-free generation by 2030, knowing also that aid, support from outside also has been dwindling, and it may cease. What are we doing? In line with this, the Ghana AIDS Commission had set up the HIV Fund. It is there. It is there for all Ghanaians to contribute towards. So I want to seize this opportunity also to call on Ghanaians. Please contribute to this fund. It has a short code, which is *9898#. I repeat, *9898#. When you go there, you follow the directions, and please make your contributions as Ghanaians to Ghanaians living with HIV, so that together we can keep ourselves alive. Together we can reach undetectable status, and with your support, we wouldn't transmit HIV to anybody. So I'll end here by acknowledging all our stakeholders that have stood behind us tirelessly, giving us support in every way. And they've all been mentioned here. So thank you for all that you have done and all that you continue to do. And may God bless us all as we stand together as a country to fight against AIDS. Thank you very much.
Let's do it better for her. It's not easy to devote your life, despite the stigma, to educate people that there's treatment, and as such, they should go for it. That was the president of the network of people living with HIV, sharing some testimonies with us. Thank you so much for those stories. It's going a long way to encourage other people to go and test, know their results, and also go for the treatment if positive. Thank you so much. So we'll move on with the rest of the agenda, and we've reached the climax of today's activity. And I'm happy to invite my boss, who is the Director General of the Ghana Health Service, Dr. Patrick Kumar Boaji, to formally launch it. And also, we have something here that he's going to unveil. That is the logo for the ART at 20. When he finishes with his speech, I will urge all the people on the first row, including our chairperson, as well as Ms. Malaika with the scissors, so that he can unveil the logo for us. So thank you very much. With a round of applause, please help me welcome DG.
Thank you very much. Nowadays, when you come with your tablets, you also carry your paper as insurance. Dr. Chair, good afternoon all. Let me stand on existing protocol to deliver my address. I wish you a pleasant afternoon to you all. Today I stand before you to celebrate a remarkable achievement in our beloved country, Ghana. That is the widespread use and success of HIV antiretroviral therapy known as ARVs. Ladies and gentlemen, this is a momentous occasion that calls for recognition, reflection, and look towards the future. HIV remains a major public health threat worldwide still. According to UNAIDS, it is an estimated 39 million people worldwide were living with HIV in 2022, with 29.8 still million assessing antiretroviral therapy. First and foremost, let us acknowledge the critical importance of ART in the lives of individuals living with HIV. Before the initiation of a highly active antiretroviral therapy in December 2003, care for patients living with HIV was focused mainly on managing opportunistic infections and providing psychosocial support. And I remember the advert that was virtually scary. I mean, as soon as you look at it, you just, if I'm going to die, why bother? So I think it also created a lot of stigma. This resulted in HIV infection being seen as a death sentence, but ART has revolutionized the treatment and management of this devastating virus. Antiretroviral therapy is a combination of antiviral drugs that effectively suppress the replication of HIV in the body. By doing so, ladies and gentlemen, delays the progression of the disease and allows those living with HIV to live healthier, longer lives. ART not only improves the quality of life for individuals, but also reduces the risk of transmitting the virus to others. It is thus a powerful tool that contributes to individuals and public health. Dr. Chair, permit me to take you on a walk down memory lane. In March 1986, Ghana diagnosed our first AIDS case. And in May 86, 26 cases had been identified. We had then established our National Advisory Council on AIDS, NACA, and the National Technical Committee on AIDS the year before. Subsequently, the National AIDS Control Program was established a year later under Ghana Health Service, and they were tasked with prevention, treatment and care and support for the clients infected and affected by the condition. In September 2000, the Ghana AIDS Commission was established, and its responsibility was to coordinate the multi-sectoral response, which was critically needed. Ladies and gentlemen, with structures well in place, the first national decision on the provision of ART for persons living with HIV was taken in the year 2000. The national therapy guidelines were developed in 2002, and the pilot provision of antiretrovirals was done in 2003 at St. Martin's de Porres Hospital, Agomenya, and Atua Government Hospital, with a scale-up to Kolebu Teaching Hospital, Konfano Teaching Hospital in 2003 and 2004, respectively. Ladies and gentlemen, this was ably supported by the Global Fund. In the same year, 2003, ARVs were commercially available with support from Farm Access International and USAID supporting Akai House Clinic, Yahoo Medical Center, Holy Trinity Hospitals, and MedLab. This is to say that the private sector was not left out in our response. The treatment acceleration project by the World Bank also came in with support for testing approaches meant to scale up treatment to the public-private partnership in facilities like Family Health International, Private Enterprise Foundation, the Catholic Health Services, to mention a few. They also provided institutional capacity for treatment through the World Health Organization, and they facilitated the learning from treatment as prevention type countries. There was, however, a rapid scale up the ARTs to 15 sites by December 2005, and subsequently to 138 districts by 2010. This was supported by a Global Fund in the round 5 funding cycle. That's 2010. 35,000 persons living with HIV were put on treatment. In Ghana, we have made significant strides in the provision of accessibility to ARVs. The government, in collaboration with international organizations and healthcare providers, has undertaken commendable efforts in expanding the coverage of ARVs. Today, more Ghanaians living with HIV have access to these life-saving drugs than ever. The government had established treatment centers across the nation, ensuring that individuals have a place to seek care and access ARVs. Dr. Chair, additionally, treatment guidelines and protocols have been developed and implemented to ensure the delivery of standardized care throughout the country. The achievements we have made in Ghana are truly remarkable. Not only have we increased the number of people accessing and adhering to ARVs, we have also witnessed a decline in HIV-related mortality rates. This means that more Ghanaians are living longer, healthier lives with HIV, and we just seen an example. Moreover, the rate of the new HIV infections have been declining thanks to the combination of ARVs with comprehensive prevention strategies. These achievements are a testament to the commitment and collaborative efforts of government, healthcare professionals, civil society, international organizations, and all the people of Ghana. However, our journey does not end here. There is still much work to be done. Despite these achievements, challenges remain, and we must address to ensure that ultimate success of our fight against HIV is done. Stigma and discrimination towards individuals living with HIV persists and act as a formidable barrier to testing, treatment and adherence to ARVs. Ladies and gentlemen, to overcome this, we must intensify efforts to educate and sensitize communities and dispel the myths and misconceptions surrounding HIV and ARVs. Furthermore, we must strive for the sustainability of our ARV programs. Adequate funding is essential to ensure a consistent supply of ARV medications and the proper function of the treatment centers. We must also strengthen our healthcare infrastructure, ensuring that healthcare professionals are trained and equipped to effectively manage HIV and provide continuous care. Lastly, ladies and gentlemen, we must never underestimate the power of prevention. Whilst ARVs are crucial in managing HIV, prevention is equally significant. We must emphasize the importance of comprehensive prevention strategies, including education, condom distribution and use, the promotion of voluntary counseling and testing and services, and by combining preventive efforts with the widespread use of ARVs, we can work towards the AIDS-free generation. Ladies and gentlemen, Madam Chair, as I conclude, let us celebrate the progress we have made in Ghana regarding HIV antiretroviral therapy. ARVs have transformed the lives of individuals living with HIV, offering hope, health, and longevity. The achievements we have made thus far are a testament of what we can accomplish when we work together. As we move forward, let us continue to address the challenges that lie ahead, ensuring the accessibility, sustainability, and efficacy of our ARVs programs. Together, let us ambition a Ghana free from the burden of HIV, where every citizen can live a healthy and a thriving life. Thank you very much. Thanks for your attention.
Thank you very much. So I will invite all the members on the first row, as well as our Ms. Malaika, to come and support Chair, support DG. CDC, please join. Yes. So are you set? Okay.
Five, 4, 3, 2, 1. Five, 4, 3, 2, 1. Five, 4, 3, 2, 1. Five, 4, 3, 2, 1.
Celebration. I will go over some of the programs. So anywhere you see this logo, it should remind you that there's treatment for HIV, and people have been on the treatment for 20 years, and it has been beneficial to them, and they are still living with hope. Thank you so much. Thank you so much. So, DJ and our dignitaries, please, you may take your seats. Have you taken picture of Chair and DG? There will be a picture session too. Thank you so much. Thank you, Ms. Malaika, for the scissors. So, We are gradually coming to the end of the program, and before I give the microphone to our chairperson to formally close us with her remarks, I would like to take us through some of the commemorative activities that has been outlined here. Let me say that the planning committee is chaired by and directed by the Director General of the Ghana Health Service, Dr. Patrick Kumar Boaje, with membership from other CSOs as well as other relevant agencies like the Ghana AIDS Commission, and they are steering the affairs for some of these activities. So we just did the media launch, which we are here today. The documentary that we just watched was just an excerpt. We are looking at a full documentary that will be out soon. Then there's a program that we are saying is media engagement on ART that will be themed ART Saves Lives. We'll give you the data and where we are approaching. There will also be a tour of some historic ART site plus a commemoration project. We have something that we call Special Time with NAPLAS, our cherished recipient of care that is debt, leaving no one behind. Then we are going to also have inter-schools and colleges quiz and debates. There's also going to be HIV ART, touching base with out-of-school young adolescent with Miss Malaika. So that is part of the activities for her. Then school-based seminars for young adolescent on HIV ART with Miss Malaika and experts from the program. Then national charity ART Cup soccer competition between PAS soccer players of Accra House of Folk and Kumasi Asante Kotoko. There will also be a health walk that is themed Adhere to Survive and an ACE rally. There's also going to be a national stakeholder dialogue on ART commodity security. That is going to be themed Procure HIV commodities or perish with passion. A national crisis of drug resistance, morbidity, and mortality. There's also going to be a national stakeholder dialogue on ART, documentation on ART at 20, including reorganized NACP Library Hall of Fame. Then there's going to be a legacy project like the modern e-library project and countdown to epidemic billboards across the country. So when you are driving through the street, you see some of the billboards with messages on HIV. Then climax of event on World AIDS Day celebration, DEBA, which we usually do every year. Then climax of event on World AIDS Day celebration, dinner and award ceremony. Then legacy project at ART side. We will keep you posted as media partners as and when we are about to do all these programs. Thank you so much for your support, and we know you are going to help us in all these activities. So we are coming back to the program, and I'll call on our chairperson, Dr. Mokua Blay Edujemfi, the presidential advisor on HIV/AIDS, and also the chairperson for today's program, to formally close us. Please help me welcome her. Please, let's do it better for our chairperson.
Thank you very much. Thank you very much. Ladies and gentlemen, let me also add all protocols observed. In fact, let me say that I've been done a favor by being made to chair this function. I thank Dr. Ado for bringing me back here. You've rejuvenated me. In fact, you've cut 20 years off my age. I was so happy to be here and see Margaret, my Margaret. I mean, we work together at Ghana AIDS Commission. Whenever I see her as the MC of an event, I know I'm going to be okay. And then now I've been introduced to Mr. Akwaiza. It's been a wonderful, wonderful program. And I think more to my benefit, to even your benefit, and to the benefit of everybody. You know, Ghana has come a very long way in the fight against HIV. We have seen the progress of management of this disease throughout the years. And we are now here, we are now here because of the effort of many people. The future looks bright as we move forward towards the goal of ending HIV pandemic in 2030. We can never forget the dedication and the perseverance of healthcare professionals, researchers, activists, and individuals living with HIV who have been instrumental in advocating for and advancing the availability of antiretroviral therapy. The unwavering commitment to improving treatment, access, reducing stigma, and promoting education and awareness has been pivotal in shaping the progress we celebrate today. As we embark on this year's long celebration, we must also recognize the ongoing challenges that persist in the fight against HIV/AIDS. Despite the advancement in treatment, there are still barriers to access, disparities in healthcare, supply chain issues, and persistent stigma and discrimination that continue to affect those living with HIV. It is imperative that we remain steadfast in our commitment to addressing these challenges and ensuring that everyone, regardless of their background or circumstances, has access to life-saving treatment and care. Looking ahead, we must remain vigilant in our efforts to advance research, innovation, and collaboration in the field of HIV treatment and in prevention. We must continue to advocate for increased funding, as was said by my dear lady here, improved healthcare infrastructure, and the development of new and more effective therapies. Together, we can work towards a future where HIV is no longer a global health crisis. I was happy with the statement made by Nana Poku, Dr. Nana Poku, the doctor who is a chief. Today, we launch this celebration. Today, as we launch this celebration, let us honor the lives that have been touched and the progress that has been made. Let us stand together in solidarity, united in our commitment to ending the HIV pandemic and ensuring that antiretroviral therapy reaches all those in need of it. In closing, I would like to express my deepest gratitude to all those who have contributed to the success of antiretroviral therapy. Your dedication, passion, and tireless efforts have made a profound impact on the lives of individuals and communities affected by HIV/AIDS. Together, let us continue to strive for a world where everyone can live a life free from the burden of HIV. Thank you for your cooperation. I think it's been a wonderful program. And you've made me determined not to stay indoors. I'm going to come out and celebrate with you for a successful ceremony. And so let the celebration begin today with the Valentine's Day, Ash Boys Day, and everything. Thank you very much.
Please, we can do it better for our chairperson. Thank you very much, and we'll be seeing you in most of our programs too. Thank you. This brings us to the end of the program. I've been told today is National Chocolate Day. I don't know, there's a surprise for everyone. So there's a surprise for everyone, so the PM will tell us. But let's take note of this announcement. After here, there will be one-on-one interview with our dignitaries, and we'll communicate to you so that you can put it in your agenda. Then the media interviews will take place where I was sitting. We'll move the chairs from there. That's where we'll do the media interviews. After the closing prayer, we'll arrange here for group pictures, and I'll go by how the pictures are going to be taken. We'll first have our dignitaries, then all partners will join in. We will have the NACP plus Ghana Service staff, then the planning committee will also come in. So in that order, let's take note of it. So I'll invite the program manager for National AIDS Control Program in the person of Dr. Isiado to give us a vote of thanks. Please help me welcome him. And a surprise too.
Thank you, Jacob. On behalf of my Director General, Dr. Patrick Kumar Abuaji, I wish to thank our media partners for responding to our invitation today as a show of the demonstration of commitment to project this event and all activities slated for the year-long celebration. To our distinguished partners, the Global Fund, CCM, the JUTA, PEPFAR, CDC, the US system, and all NGOs, we are very grateful for your financial and technical investment that has enabled us to restore hope in our recipients of care through antiretroviral therapy delivery to date. This was testified by the president of NAPLAS. Your support has and will continue to make it possible for us to pay a glowing tribute to all persons living with HIV, those lost to follow up or even gone to eternity, and those currently on treatment. We celebrate all the recipients of care who are the reason for this season. Our unalloyed appreciation goes to our former program managers. I have my father and my grandfather here, Dr. Nia Koyado and Dr. Emil Asamode. I appreciate you. I salute you for the efforts you've done, the foundation you've laid, and with all the staff for your foundational leadership and dedicated service that has established a tangible basis to ride on the success chalk so far towards epidemic control. The selfless and sacrificial work of healthcare providers in the public, quasi-government, private, community settings, and all levels of implementation, from national to the chips, is worthy of commendation. We are forever inspired by our institutional and political leaders for your guidance, our Director Generals, for the coordination, our directors, public health, and everybody, the support that you have provided for us. Huge thanks goes to you for the catalytic leadership to date, including steering today's launching ceremony to a safe birthing. This is just the beginning of our gratitude to all the ART at 20 Celebration Committee members and consultants. Let's put our hands together for the committee members. They have done a great job, and our consultant, Chief Natin Saku, for the passionate expression of poise and capacity to sustain the gains through your role in the coming weeks to the end of the epidemic. The first Kokroko tomorrow is reserved for our chairperson, Ambassador Dr. Mokwable Edujemfi, and the distinguished officials at the front row and other invited guests here today, including our MCs, Jacob and Margaret, great MCs. Join me to crown my vote of thanks with a word of prayer to God Almighty, our Alpha and Omega. Please be on your feet and let's thank God with a prayer. Close your eyes with me and say this after me. Bless the Lord, O my soul, and all that is within me, bless his holy name. Bless the Lord, O my soul, and forget not his benefits, who forgives us of all iniquity and delivers us from all destruction and heals us from all diseases and infirmity, including HIV. Who renews our youth like the eagle and fills our mouth with good things. Bless the Lord, O my soul, and all that is within me, bless his holy name. May the Lord bless and keep us all to witness the historic end of HIV epidemic. To him who is able to do exceedingly abundantly, be all glory, honor, and adoration in thanksgiving. Amen. So today is Valentine's Day, and on behalf of the Director General, we deliver to you the Valentine package. In Ghana, we have christened it as the Chocolate Day. So nobody should live here without a Valentine chocolate. And so please take it, spread love, don't spread HIV, spread the message. Inform everybody that there is a celebration which is going to be year-long. And of course, invite everybody to join this celebration. We'll be coming to everybody for support in different ways. And I want to thank you all. God bless you. Shalom. I hand over to our MCs. Thank you very much for coming.
Thank you very much. Thank you very much. So we'll go straight to the picture taking.